Hi, my name is Carrie Donahue, and I'm Associate Director for Grassroots Advocacy at the Crohn's and Colitis Foundation. Welcome to our discussion about navigating insurance denials. I'd like to introduce IBD patient Scott Zwiegel, who can share his perspective on this issue.
Thank you, Carrie, and hi, everybody. Thank you for taking your time to watch this forum webinar. As Carrie said, my name is Scott Zwiegel. I am an attorney by trade, a commercial litigator with the Atlanta office of Bradley, Arant, Bolt, and Cummings. I'm also an IBD advocate. I've served on the board of the Georgia Chapter Board of Trustees for about 6 years now, and I'm just rolling off a 3-year stint as president of the Georgia chapter. More to come after that, but also help with advocacy efforts however I can, because the Crohn's and Colitis Foundation, and they're not paying me to say this, does a great job of advocating on behalf of all our constituents and those dealing with Crohn's, colitis, IBD generally. As a lawyer by trade and a Crohn's disease patient for almost 25 years, I am either fortunate or unfortunate, depending how you look at it, to know a lot about insurance coverage issues, insurance laws, treatments for IBD, and navigating all of it. Having been personally on Remicade every 6 weeks for about 23 years now, I've worked hard to keep my Crohn's under control and know that that works for me, but it also means that I wear battle scars from dealing with insurance companies to try to stay on the biologic that I know works to keep my Crohn's disease under control. Whenever there's a change in insurance or annually, when there is a renewal of the prior year's authorizations and those inevitably get rejected, the process starts all over. And as you heard previously, persistence is what matters. And keeping at it and not taking no for an answer is very important when you're trying to get on the medicine that your doctor wants you to be on. Because you would think that an insurance company would see a 20+ year history of a medication working and approve it. But then again, you're watching this forum or webinar, so you likely know that's not the case. It's something that most folks who have IBD have to deal with in some form or fashion, particularly if you're on one of the more expensive medication. As you may have heard before, a staggering 17% of in-network claims for IBD medications are denied. And that's a frustrating and unacceptable number. So hopefully some of my tips you'll be able to use to get a denial turned into an approval yourself. I think it's frustrating to know that, at least in my mind, a medical decision should be made between a doctor and a patient. But medicine is expensive, and insurance companies are just that. They're companies. They're there to make money for their shareholders and for their businesses. So one way that they do that is to say, well, we're not just going to pay for something that is expensive, and they'll rely on the fact that most people don't chase a denial, and most people will take no for an answer and move on to the next thing. But if you're persistent and you're tenacious and you don't do that, I'm here to tell you that you hopefully will ultimately get an approval for the medication that you actually need. And we can fight back against the insurance company's model to deny certain claims and actually get what both your policy and the law allow and provide for. So just to kind of walk through a few tips on how to navigate the insurance denials, which unfortunately is a process that happens a lot, as I mentioned. First, and it should go without saying, but that's only because it's what I do for a living, but you need to read your policy. You need to know what your insurance policy says, what it covers, what it excludes, how that coverage and the exclusions work, and also what your rights are in the event of a denial. What can you do if you get a denial? Who do you call? Who do you talk to? All of that is very important, and it's written in your insurance contract. And because the insurance policy is a contract, your coverage fight will ultimately come down to what's in the policy. And my guess is if you look at the language closely enough, you'll see that whatever you're trying to get either should be or is covered based on an interpretation of the policy language. Now, I recognize that an insurance company has a big advantage because they have whole teams of people that do nothing but look at these contracts, draft these contracts, know what's included. But at the same time, there's no better advocate for your own health than yourself. And if you understand what's in your policy and you're able to point to specific language and specific processes that are in the policy, your chances of getting a denial overturned go up tremendously. To that end, and I guess the second tip would be communicate with the insurance company about the policy. Ask questions. Ask the insurance company to send you the documents they use to make the decision or the denial. Ask the insurance company what specifically they considered. Ask the insurance company whether they considered, for me personally, my 20+ year history of this particular medication working and my doctor's letters that say it's not worth the risk, even if small, that changing to a different biologic would cause. These are specific little facts that you can take to talk to the insurance company to help them do the right thing and get an approval for whatever you're on. You should also ask the insurance company to give you information about the policy. Oftentimes, they're looking at talking points or stuff that's in the system, and it doesn't marry up with the specific policy that you have. If you read your policy, you can point that error out to them, and you can make hay out of it, and you can oftentimes cause the insurance company to realize that they're doing the wrong thing if you point these things out. So if you have questions, make sure you ask them. And if you don't get an answer, you have to continue to ask until you get a acceptable answer, whether that means calling and talking to a different representative, whether that means going to an escalation department, whether it means, taking what's kind of a meme today, but asking for a supervisor and getting somebody who actually knows what they're talking about to answer your questions. You should press all of the buttons and not be afraid to ask until you get the right answers. And perhaps most importantly, when communicating with the insurance company, take detailed notes of all your conversations. You can use these notes later in drafting letters and communicating with the insurance companies, or, if necessary, bringing an action to court to try to get the insurance company to do the right thing. All of your notes can be used as evidence in those fights to say, look, I talked to Joe on December 5th at 1 o'clock, and it was an hour-long conversation, and he said X. All of that stuff is very helpful in talking about an insurance denial with the next person. So write down when you called, how long you were on the phone, what the representative told you. And I personally like writing down quotes that are helpful to me, because oftentimes, especially after you go through your whole spiel about this is what's happened to me, you might get a representative that is sympathetic to your cause and might say something outside of their script. All of that is very helpful in trying to get a denial reversed moving forward. Also, if somebody says they're going to call you back, hold them to it. Ask what number they're going to call you back from. Add it to your contacts so you make sure you don't miss the call. Ask when you should expect a response. And perhaps if you get lucky, you can say, what is a good callback number, so that when inevitably somebody doesn't call when they say they can, you can get to the right person. So if you have that, and a lot of insurance companies have escalation departments or supervisor lines that they don't give out freely, but if you're persistent enough, you can get that, and then you can continue to talk to somebody and be the squeaky wheel to try to get the right thing that happens, or try to get the insurance company to do the right thing, excuse me. And it requires multiple calls. It requires talking to representatives. It takes getting hung up on multiple times mysteriously. It takes repeating the same story over and over again. But again, be persistent. That is what it takes. The insurance company is banking on the fact that you're not going to do that, and they're going to save money if you don't use all of the tools in your toolkit. So the response is to use all the tools in your toolkit, use all the arrows in your quiver. These are medications that are necessary for you to live your best life. Remember that. You have more of a dog in the fight than the insurance company does. So do whatever you can to try to get an insurance denial reversed. Third, you've got to know kind of what the appellate process is for your insurance denial. And that sometimes comes from the policy itself, and it sometimes comes from state law. So not only should you read your insurance policy, but also be familiar with your state law on the insurance code, what your state insurance code says in your state law, what it says about appellate process. Does it allow you under the law the opportunity for an automatic right to appeal or an automatic right to another level of appeal? All of these things are very helpful, but not a lot of people use them. And again, the insurance company is counting on the fact that you're not going to pull all the strings that you need to pull. And also, as you might hear later, or you might be familiar with, step therapy is a big issue with IBD population. And a number of states, thanks in part and large part to the advocacy efforts of Crohn's and colitis, the Crohn's and Colitis Foundation and Crohn's and colitis patients, a large number of states have step therapy acts that provide legal barriers so that the insurance company can't deny you based on step therapy reasons in certain circumstances, or they have timing and triggers for if you were denied for a step therapy reason, your doctor or you can request a reversal of those denials, and the insurance company only has a limited time period to act. Now, in my experience, because I know what the state law says and what the exceptions for a step therapy protocol is, I am very careful to use the magic words in every conversation that I have. And I'm very careful to tell the representative that they have, let's say, 48 hours in an urgent situation to approve my medicine. Inevitably, the insurance company will very likely miss those deadlines. That only helps you later, right? They're not going to act in the time period. They're going to give you multiple fax numbers, and the left hand at the insurance company is not going to know what the right hand is doing. And you're going to be very frustrated by the fact that they're not doing what state law requires. Well, continue to use that as a mechanism to try to get the insurance denial overturned. So review your state statutes governing insurance policies and don't be afraid to use them. Too often, patients will use an insurance company determination without being fully aware of their rights. Also, and in your denial, it likely says this, but you haven't read all the way down to the small print. Most states have insurance commissioners or other agencies that are tasked with overseeing compliance with the state insurance statutes. These statutes and these agencies often provide protections to patients. Don't be afraid to use them. Call the insurance commissioner. Tell them what's happened to you. Sometimes the insurance company will get a ping from an insurance commissioner or an agency in a certain state, and that's the catalyst needed to get your denial turned into an approval. So, most importantly, make sure the insurance company knows that if they don't provide the coverage, you're going to be stubborn and you're going to do everything that you can to make sure that you get the medication that is owed to you. I think that's, my wife says, is one of my both best and worst qualities, is the persistence and the fact that I'm going to be stubborn. And because this medicine has worked for me for 23 years, if the insurance company tries to get off of it, instead of switching to something else, which then means I'm on that something else, I'll get sick to show the insurance company that they're the ones who are preventing me from getting healthy, and it's going to end up costing them a lot more money. So you can be stubborn, but use all the tools available. And then I would say the last kind of tip, which is multiple tips, is to use the professional help that's available to you. Your medical professional, your doctor, they're there. They want to help. They've dealt with this situation with a number of patients, but they also deal with the insurance issues from a numbers of patients and might be overstaffed and might not have the time to deal with your issue. But be persistent, be the squeaky wheel, call, be polite, ask for more information, hold them to what they should be providing to you. Give them information to help with the insurance denial, right? Because doctors oftentimes can be the linchpin of getting a denial reversed. Ask them to take the time to do a peer-to-peer with the insurance companies. Ask them to submit a letter that details why it's necessary for you to be on a particular medication. Help the doctors with dates, numbers, information that you provide to the insurance company and they provide to you. All that stuff is very helpful in the appeals process. Because keep in mind, it's essentially a war of attrition. The insurance company is trying to wear you down as much as possible. Don't let them. you have to use all the tools in your toolkit. And I keep saying that phrase, but be persistent, because that's the way that you're going to get a denial turned into an approval. In addition to your doctor, you also likely have through an employer or through an HR department, through a benefits administrator, folks who A, want to help, and B, it's their job to help. So you can talk to the insurance company on your own behalf, and at the same time have others working for you too, to say, this is Scott. He's been on this biologic for 23 years. It has worked for him. Here's the concern and the risk that we have in the event that he is denied this particular medication. Or, if I'm particularly stubborn and in a particularly long and dragged out fight, Scott is getting sick and missing work because you are denying him medication that he's entitled to and his doctor wants him to be on. So there's folks like your employers, your HR department, benefits administrators who are there and want to help. Also, talk to peers, talk to others who you may know have IBD. They've had similar fights and they may have tips and tricks. They might have the right number at the insurance company to call that helps move things forward. In addition to the doctors, your work, your peers, you can also reach out to manufacturers. You can reach out to folks like Janssen, who makes Remicade. They have literature that describes why perhaps the medication should work for you in this circumstance and why something different might not work. You never know what resources they have. Take advantage of those resources and use them. And then finally, the Crohn's and Colitis Foundation has tremendous resources and a staff that's there and wants to help and is willing to assist. And the fact that you're watching this means you're likely already aware of the resources. Don't be afraid to use them. They're tremendous, and you should, and it'll help you get a denial turned into an approval. So in sum, there's a lot of things that you can do, but remember, you are going to be your own best advocate for getting a denial overturned. And do whatever you can. Be persistent, be tenacious, be vigilant, be your own advocate, and don't take no for an answer. Thank you.
Well, thank you so much, Scott. These are very, very helpful tips and a lot of great points that you made. We just really appreciate you sharing your perspective on this. And I think these tips seem to clarify what can seem like a really very complicated process to navigate for IBD patients. And I just think it'll be so valuable for other patients to hear from you. So thank you. And I'm hearing from your perspective that persistence is key. That's what I'm seeing as the biggest takeaway from what you shared. But I'd like to know what gives you the most hope when it comes to this issue of insurance denials?
That's a great question. I think the hope is that people can take some of these tips and look at me and look at the fact that I've been able to maintain the same medication for 23 plus years after countless fights, and know that there is hope available. Know that despite all the frustration, despite wanting to pull your hair out, despite knowing that what an insurance company is doing is completely wrong, there is a light at the end of the tunnel. And if you take advantage of what the policy says, what the law says, the different layers of appeal, ultimately, if it's the right medication and you're able to persist, hopefully you can get an approval. So, I think what gives me the most hope is there are folks who have done it and done it well, and there's organizations like the Crohn's and Colitis Foundation who's out there to provide the resources to say, hey, here's what we need to help to get you on the medication that you need. Also, one other tip, and you can see the bulldog here on my desk. That's because of my sports fanatic fandom for the University of Georgia, but it's also a good lesson. Be a bulldog. Don't take no for an answer.
It's a really great point. Thank you so much, Scott. We really appreciate this.
Thank you.
We hope those of you who tuned in today found these resources helpful. And thanks again to Takeda and Janssen for supporting today's panel. Please visit our website at crohnscolitisfoundation.org to access some of the resources discussed today. And again, I'll say it one more time, don't forget to join our advocacy network at crohnscolitisfoundation.org/advocacy to be a part of these advocacy efforts. Thank you.